So, Dr. Roden, the other day, came across a podcast, New Heights podcast with Jason and Travis Kelsey. And I'm not sure if you know who this person is, but Taylor Swift happened to be on there talking about a condition that her father had. It had to do with his heart, and apparently he had been receiving regular checkups, seemingly healthy. However, he went to a physician, I guess, and something about a test that was done regarding his resting heart rate or something like that, that revealed that his heart really wasn't in good health.
Okay.
And as a result of that, they were able to intervene early and potentially prevent a significant event from happening. Have you heard about this podcast?
I had heard about it, and then I knew you were coming in today, and we were going to be talking about this, so I watched the podcast.
Okay.
I do know what he got that was able to make the diagnosis, and I understand the story with the EKGs always being normal, and then all of a sudden this other test showed he had serious life-threatening disease. But it was, thank goodness, caught early. I'm glad you bring it up. I'm glad you're coming in today because I can do that for you. When I saw that podcast, I was like, oh my gosh, this is fabulous. Because at MiraBelle, we offer that and more, that we can be more preventive in catching your disease early.
I have a question then. I have had an EKG. My cardiologist shared with me that I have a slightly dilated left atrium.
Okay.
From what I understand, that means it's slightly enlarged. Mm-hmm. He says, hey, you're fine, don't worry about it. I'm not worried about it. Which is all well and good.
Yes.
When you're not the one carrying this around inside your chest, right? So
understand.
So I have in the back of my mind all the time a concern. I'm 59 years old, so I have a concern that my heart is healthy, that I'm living the right lifestyle. Is there a test or is there a way that you could provide me with better information about my heart health, better information about my potential risk factors so that I could do some preventative things versus reacting late, after a heart attack or some other condition?
And I'm glad you asked because I'm a retired NASA flight surgeon, as you know. We had astronauts that were going to go into space, and going into space is risky business. Our whole goal as a flight surgeon was to prevent the disease happening when they're in space, but we also want to get them healthy terrestrially. With a group of cardiologists, flight surgeons, specialists, they developed a calculator, if you will, that by taking different modalities and putting them through an algorithm, I can give you an exact percentage risk of cardiovascular disease. But it does even more than that. You come in as a patient. Mm-hmm. I do the traditional history and physical, like you always get. I'll do an EKG just to have a baseline. And since you've talked about your atria, I just want to surveil to see if there's been any changes. I then need to draw your blood. I need to measure your cholesterol, a marker called a high sensitivity C-reactive protein. Okay. That's a long word for a little molecule that measures inflammation. I then am going to ask you to go to a radiology suite, and I'm going to have you have a CAT scan done. It's low radiation, so it's not like your typical CAT scan, but it's specifically designed to measure the calcium deposits in your coronary arteries. So I see an anatomic disease